A political showdown over the Affordable Care Act in Congress. Yesterday, President Barack Obama, Vice President-Elect Mike Pence, both went to Capitol Hill to rally their opposing sides. The president, of course, sat down with Democrats, making it clear he wants his signature legislation saved. He reportedly told Democratic lawmakers not to help Republicans by rescuing them in passing replacement measures, and also forwarded the idea of calling the Republican plan Trump Care. Well, meanwhile, Vice President-Elect Mike Pence was also on Capitol Hill meeting with Republicans, and he made it clear they're going to also undo the Affordable Care Act. So far, there are no specifics about a replacement plan.
Obamacare has failed, and the American people have sent a decisive message to Washington, D.C., that they want Obamacare to be repealed and replaced with health care reform that will lower the cost of health insurance without growing the size of government. We're also working on a series of executive orders that the President-elect will put into effect to ensure that there is an orderly transition during the period after we repeal Obamacare to a market-based health care economy in America.
Yes, Senate Democratic leader Chuck Schumer said Republicans will have a disastrous impact on the country's health care system.
Republicans are plotting and soon will be executing a full-scale assault on the three pillars that support the American health care system: the Affordable Care Act, Medicare, and Medicaid. The Republican plan to cut health care wouldn't make America great again. It would make America sick again and lead to chaos instead of affordable care.
Joining us via FaceTime from Charleston, South Carolina is Anton Gunn, the former Director of External Affairs for the Department of Health and Human Services. Anton, when you hear Republicans say they want to repeal the Affordable Care Act, others call it Obamacare, in 8 years they've been saying that. I still have yet to see a replacement plan. You would think in 8 years you might come up with a plan if you don't like this one.
That's correct, Roland. They don't have a plan. They've never had a plan. All they wanted to do is undo the progress that we've made to improve health care for all Americans. The ACA is one of the most comprehensive and complex pieces of public policy our country has ever passed. And so you just can't undo it by saying you want to repeal it. There's so many people who benefit from this law that don't even know that they benefit from the law. It makes it very hard to say you want to do away with one part, but not do away with all part. But regardless of what they're saying, they actually have no plan. I think there are like 7 bills in Congress right now. When you got 7 different plans, that means you don't have one plan. And any plan that they put forward will undo the fact that millions of people in America are getting coverage today that never had coverage before. You can talk to any urban hospital. If you go to Detroit, Michigan, you go to New Orleans, Louisiana, you go to Cleveland, Ohio, you talk to these urban hospitals that have been serving low-income, poor people and people who've just been straight uninsured about the care that they've been able to deliver to these people for the last 3 or 4 years. Now imagine taking it all away, telling a mother that she can't get the hysterectomy that she's needed and her doctors recommended, or that breast cancer surgery, or even just to deliver a baby because you no longer have coverage. So they've been talking this talk for a long time, and now they get the opportunity. They've been chasing this ice cream truck, and they finally have caught it, and let's see what they do with it.
Now, of course, yesterday, President Barack Obama met with Democrats, and one of the things that he said to them that has been reported, he said, look, don't help Republicans at all when it comes to any sort of changes to this. Your thoughts about that?
Well, my thought is that they haven't helped us do anything to improve the ACA. I mean, the ACA is no different than Social Security or Medicare when it first passed. It was limited when it came out in the first year, but over time we made improvements to make the law better for all Americans. But the Republicans for the last 6 years have done nothing but undermine it and try to stop us from doing the right thing. And so the whole point is why do we want to spend any energy helping them to undo something that has been great for tens of Americans of people every single day? Not only that, it's created jobs. You talk to these hospitals who've now been able to hire more outreach workers and more nurses and more people in training to deliver care to people in critical areas that need it. So why spend our time? Why spend any time trying to undo what's been good for the American public?
Now, what's interesting is that in July, the Washington Post did a story where Mike Pence, as governor of Indiana, expanded Medicaid in the state. So here he's saying repeal it, yet as governor, he expanded the Affordable Care Act for residents of Indiana.
Well, let me be more specific about Indiana. Not only did he expand Medicaid, but he implemented almost every important part of the ACA to cover people in the state. So the number of uninsured in the state of Indiana is at the lowest it is right now in the last 20 years. So more people got coverage. Not only that, when you go to places like Indiana University Health, you'll see the millions of people who've been getting life-saving surgeries because they have coverage because of the Affordable Care Act. So Mike Pence is saying one thing, but has done something completely different in the state.
Well,
and the people
in fact, Anton, got to interrupt you there for a second. According to this Washington Post story, what he made some modifications. One of the things that he did was he required that people, including those living in or near poverty, share more of the cost. Adults add to the program in this system required to save money each month in a personal health savings account. Quote, the money in those accounts will then be used to pay for future medical expenses for the beneficiary. But what's interesting is those with incomes above the poverty level who fail to make monthly contributions to their accounts lose coverage or are barred from applying again for 6 months. Again, Republicans criticize the tax penalty on the Affordable Care Act, but here is Mike Pence as governor of Indiana putting in rules that actually penalize folks who didn't pay into the system.
Correct. He's doing the same thing that the law has done, but actually being more draconian about it. And then if you be real honest about it, a lot of people below the poverty line don't have the ability to pay. I read a story in the New York Times about a man in Indiana who couldn't afford, because he was uninsured and didn't have a job, he was unemployed, that he couldn't afford much at all. So his requirement under the Mike Pence plan was to put $1 into a savings account to provide coverage for himself, $1. And he was able to get life-saving treatment and coverage that he needed that he couldn't get before. So we got to stop with the games and stop with all of this talk about undoing something that has been good for tens of millions of Americans who not only needed coverage, but people who have pre-existing conditions who couldn't get treatment before, they're now getting these treatments. And we can't take that away. We can't take away the quality of care as it is improved under the Affordable Care Act, because doctors are being held more accountable, they're more involved with their patients, they're communicating with them, and we're providing better access to people who have these needs.
All right, then, Anton Gunn, former Director of External Affairs with the Department of Health and Human Services. We appreciate it. Thanks a lot.
Thank you.
All right, let's go to our panel. Joy Jefferson Nuri, she is the founding CEO of In the Public Eye Communications. Ralph Chittims, principal of Black Elephant Consultants, LLC. Amber J. Phillips, the co-director of Black as well. And from the Atlantic, Adam, how you doing?
I'm great. How are you?
All right, glad to have you here as well. So I got to throw this out to you guys right now. So yesterday, President Obama tells Democrats that he encouraged supporters of the Affordable Care Act to do like the Tea Party, and that is to go to town halls and raise hell. I tweeted yesterday it would have been nice for the president to tell his supporters to show up at town halls in 2009 to come at the Tea Party as well. I made the point yesterday that he should be even, I said, look, he's having his farewell address in Chicago January 10th. That's fine. I said, go to Wisconsin, go to Michigan, go to Pennsylvania, go to a place where you have largely white working class workers who are depending on the Affordable Care Act, and hold a rally and say, I might be leaving, but I want you to give these Republicans hell and tell them don't touch the Affordable Care Act. I say go out swinging. Should the president be making these points publicly and not just behind closed doors to Democrats?
I heard you say that on the air yesterday, and I was applauding. I think that this campaign for him to go state by state, then tell the people, especially the people who voted for Trump, this is going to affect your life. You think, you know, people in these surveys said, I don't like Obamacare, but I love the Affordable Care Act.
Right.
Ridiculousness. I agreed with you, and I think the president who now wants to rebuild the Democratic Party as his mission, as his post-job mission, that should be the beginning.
Yeah, and I think it will not only take people on the ground to push back, but I think we're looking at, there's a lot of articles going around on what does it mean to resist the Trump administration. We're going to have to see folks like John Lewis and all the Democrats, again, filibustering, taking to the Senate floor and deciding not to leave, doing all of these tactics that we normally expect activists to do on the ground, but Democrats are also going to have to change how they're doing this. Republicans repeal ACA at every turn. What does it look like for Democrats to stand up and not allow these votes to go through to save health care for the American people?
Now, Ralph, 8 years Republicans have criticized the Affordable Care Act. How do they not have a plan 8 years later?
Well, as the gentleman on the show said, there are a number of different competing plans from different factions. But I've said on this show on numerous occasions, repeal and replace is basically soundbite politics. And honestly, what needs to happen is there are certain aspects of the Affordable Care Act, Obamacare, which do need to go. So I've always preferred to use the term gut and restructure, because honestly, that's what really needs to happen. Repeal and replace is soundbite politics. It means nothing. But there are aspects of the ACA that do need to go. There are some people whose penalties are now $300-400 a month. For some people in certain parts of the country, that's a rent payment. But now the parts of the ACA that need to stay, children being able to stay on their parents' insurance until 26. The fact that if you have a pre-existing condition, you can't be prevented from getting insurance. Things like that need to stay. Yeah. So that's why I prefer to say.
That's the plan. Yeah.
But when I said things like the penalties and things like that, so that's why I prefer to use the language, gut and replace instead of repeal and replace, because repeal and replace really is a foolish policy.
But because the Republicans have spent so much time being hateful towards the ACA, asking to repeal it, there is a conversation that needs to be had around improving the ACA, right? Actually moving towards a real public option. But now we're in this point where, because no Republicans have ever said these points that you're saying during those arguments, we are now looking at the ACA being just thrown out the window.
Adam, question for you. President says it behind closed doors yesterday. My deal is, say it publicly. Challenge your supporters to raise holy hell when it comes to do it. Don't just say it behind closed doors. Democrats, say it publicly.
Well, I'm not sure what we're going to see the president do after he's out of office. I mean, I think at this point, he's obviously made it a priority to have sort of an orderly transition, to, make it clear that his priority is acting presidential. But once the fight begins in earnest, I wouldn't be surprised if we saw him take a more active role.
Well, again, I just think that, I got it. You meet with Democrats behind closed doors. Look, you only got now 15 days left in your presidency. Come out, say it publicly, and challenge your supporters to say, let's raise holy hells.
Kickstart your day at 7 and get the news you need from the perspective you want. NewsOne Now with Roland Martin. Every weekday morning at 7 on TV 1.